wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. I want to visit with you men about hormonal changes and hormonal imbalance and how that can adversely affect your health as you mature. We all know that the predominant hormone in males that governs their behavior and their physique is testosterone. And testosterone, of course, is initiated at the time of puberty. You begin to make testosterone, and little boys with high voices that sing in boys' choir now start to have low voices, and they're singing bass, and they're getting hair on their face, and they're getting muscular, and they start noticing all the girls around them, and then they join the army, and somebody throws a machine gun to their hand and says, charge the hill, and they charge that hill in the face of all opposition because their body is flooded with testosterone. Testosterone governs male pattern behavior. It affects, most importantly, the way men think. It affects their moods. And I want to visit with you about that. As testosterone rises in the mid to late teens and early 20s, it reaches a peak level. And testosterone peaks out somewhere in the ages of 18 to 25. You get your peak levels of testosterone. Testosterone affects a man's initiative, his assertiveness, his sense of well-being, his moods, his goal orientation, his drive, his directiveness, his decisiveness, his analytical ability. And these are all brain functions because testosterone has a powerful effect on the neurotransmitters in the brain. And this leads to that male pattern behavior where men tend to be more aggressive. You know, you think about men, you think if you're a hunter, you know there's a certain time of the season when the deers are in rut and the males are chasing those gals all over the place. You know, they want to mate. And it affects human beings in the same way testosterone, and these animals make testosterone as well. It affects males in the same way. Now, interestingly enough, as men mature, their testosterone levels begin to gradually decline over time. And when we measure blood levels with a lab, the lab looks at the age of the individual when it does its test, and it has rankings. Testosterone level normal ranges for a 20 to 30-year-old are high. For a 30 to 40-year-old or lower, 40 to 50 or lower, 50 to 60, 60 to 70, 70 to 80. So oftentimes men will come in and will discuss the probability that their symptoms of that brain function we're talking about, their assertiveness, their drive, their goal orientation, they say that's lacking. They say they have brain fog. They notice their muscle tone and muscle mass has gone down. They're getting a fat belly. They can't lose weight. They may even have cardiovascular problems. Their romantic moods and inclinations aren't what they used to be, and their abilities aren't what they used to be. And we mentioned that this may be a problem, and probably is, and almost inevitably is due to low testosterone levels circulating in the blood. And they may say, well, you know, my doctor checked it and he said it was in the normal range. Yeah, you're 60 to 70 and it's in the normal range for a 60 to 70-year-old. But when you felt your best, that's when you were 20 to 30. That's when your testosterone levels were the highest. What we want to do is we want to replenish, and we want to fill the bucket back up. Think of a glass of water. You sit at a restaurant, and you've got a glass of water, and you start drinking it with your dinner. And it goes down to half half full, then it goes down to a quarter full, and the waiter comes by and you say, "Could I please have some more water?" And he goes, "But you've got water in your glass. It's in the range. It's within that range of the glass. When it's empty, we'll fill it up." That's like a doctor telling you, "Oh, yeah, your testosterone level here is down in the 60 to 70-year-old range, or 50 to 60-year-old range, or 40 to 30-year-old range. It's in the normal range." For what? Oh, for a 50 to 60-year-old man or 60 to 70-year-old man. Well, you don't want that level. You want your level to be where it was when in your 20s, because that's when you felt your best, looked your best, were your sharpest. And that's the reason we recommend testosterone replenishment. I'm 74 now. I learned about testosterone replacement therapy when I was 46, and I began on that program with an injection a week, and I've done that for ever since I was 46. I've taken testosterone supplementation to enable my testosterone levels to remain at a level they were when I was between 20 and 30 years old. And what that's enabled me to do is enabled me to be able to function and run a large multiple enterprises here at the Hotze Health and Wellness Center and elsewhere, and to be active outside in my church activities and political activities. It's given me the drive and the ability to maintain the stamina to be able to do that. Testosterone also has a powerful effect on thyroid hormone. Your thyroid gland is in your neck, and it produces thyroid hormones. Two of them, T4, which has 4 iodine molecules. This is the thyroid molecule. T3, which has 3 iodine molecules. The active thyroid hormone is T3. Most of the thyroid hormone you make in your body, about 94%, is T4. It's inactive. It's got to be converted in the cells to T3, and testosterone helps with that conversion. So as your testosterone levels go down, you don't convert the inactive thyroid hormone to the active thyroid hormone, T3, which governs your body's metabolism, your metabolic rate. So inevitably, as your testosterone levels go down, your metabolism goes down. That's why you don't think as clearly as you used to. That's why you don't have the drive you used to have. That's why it's difficult to lose weight. That's why you get a good night's sleep, you still feel tired in the morning, you need to take a nap in the afternoon, and you go to the doctor, and he draws your test and says, "We are normal." For what? For a man your age, you're in the normal range. And so we're not going to treat you with anything. Couldn't I use a little testosterone? Oh, no, but I tell you what I've got. We can give you a little stimulant here. Maybe we'll give you a little Adderall or give you something to kind of perk you up. Or if you're a little moody and depressed, and it's not uncommon for men when they hit 50s and 60s, they get anxious, they get depressed, sit around in their underwear, drink beer, and watch football games. You know what I'm talking about, don't you? Every weekend. Saturday and Sunday. And mom comes in and says, "Why don't you get out and mow the yard, or why don't you take the garbage out?" I go, "Baby, I don't feel up to it. We'll hire somebody to do that." When in the old days, you were out there running that lawnmower, you were clipping your yard, you were feeling great, you were taking the kids out, coaching them in baseball or going to their games, and you were very active. But now you're inactive. And this doesn't have to be that way. Again, your thyroid hormone is what governs your body's ability to produce energy within the cells, and you need testosterone to be able to make a proper conversion so you have adequate amount of active thyroid hormone, enabling your body to develop electrical energy so you're not low voltage, you're high voltage. You got a life, you're a live wire again. You remember when you used to be that way? There's another problem we see very commonly is as men age, their testosterone levels are dropping at a much more rapid rate. And we even see young men in their 20s with low testosterone levels. You say, why would that be? It's because of the petrochemicals in the environment. It's the soaps we use, the petrochemicals in the soaps, in the hairsprays, the petrochemicals in the dry cleaning, the pesticides we use, all the pesticides they use on the plants. It's the petrochemicals that they put into the packaged food products to help them last longer. All these petrochemicals are what are called xenoestrogens. That means they mimic estrogen hormones, and that turns down the testosterone production in men's body. I remember we had a young man coming in years back, and he had been in the pesticide business. He was 28, and his testosterone level was in the gutter, and he acted and felt like he was 60 or 70 years old. He was just dragging, and testosterone made all the difference in the world. Now, what do we do to replenish testosterone? Well, there's several things you can use. You can use testosterone creams. You can use oral testosterone, which has to be digested, absorbed, goes through the liver. But the best way to get testosterone is a testosterone injection on a weekly basis. Testosterone is so profoundly impactful, not only in energy production in our body and clear thinking for men, but it also affects your muscle mass, your bone mass, your cardiovascular function. In fact, they've done studies to show that men that have angina, when they take testosterone, it dilates up their coronary arteries and they have less angina and they have better cardiovascular function. So testosterone has a profound effect on every area of your body. And we recommend that you supplement with testosterone when it's low, and I think the best way to do it is do an injectable. So I can't ever give myself a shot. Well, it's nothing to it. You give it on the side of your leg. It's a thin needle. You just put it there and poke it in. Give yourself a shot of testosterone. You might even add a little vitamin B12 to it too. Testosterone, by the way, also stimulates red blood cell production. That's why if you've ever been in a men's locker room at a club, after a round of golf, the guys are showering, you'll notice the older guys, I'm talking in their 60s, 70s, 80s, they look pale and washed out. They're flabby. They got no muscle mass. And they don't win at the gin table anymore like they used to. They can't think clearly to play the cards. They give it up sometimes because they're losing too much money after a round of golf. Not only at golf, their handicaps are going up and they're losing money, but they're losing money at the gin table. And so then they decide, well, I'm just not going to participate in either one of those anymore, and I'll just go up to the club for fellowship. But the reason that they look so pasty and pale is because their red blood cells count go down. They're not anemic, but they're, instead of having a good high level of red blood cells where they look ready and vibrant, and by ready, I mean not ready to go, but R-E-D-D-Y, red. They're ready in their face, in their hands, and they look vibrant. And the ones that are pale and pasty, you know that they have low levels of testosterone. So if you're experiencing these symptoms, you've got significant fatigue, you got difficulty with your weight, you're not thinking clearly, you got brain fog, you've lost your drive, your directness, all your decisiveness, you can't make decisions. I even had a guy tell me one time, he said, I can't decide which sock to put on first. I mean, well, when you're that indecisive, you know you've got problems with your neurotransmitters. They're not hitting on all 8 cylinders. And testosterone can put, what I like to say, a tiger back in your tank. So if you'd like a tiger back in your tank, and by the way, I've had men come into me in their 50s with businesses that said, I just can't go on anymore. I'm going to sell it. I just can't get up and get to work. I don't have the drive to get things done. And once we got them up on the program, you know, our program is a good healthy eating program. It's replenishment of thyroid when indicated, testosterone in males, and in vitamin and mineral supplementation and treatment for allergies if they have that. When we get them up on the program, I've had them come back and say, you know, Doc, I had a guy, I remember he called me out. He asked one of the nurses to go get me out of my office. I wasn't seeing him primarily. He was being seen by another one of our physicians. But he wanted to say thank you. He said, Doc, you told me 3 years ago if I got up on this program, I wouldn't have to sell my business. And he said, you made me a multimillionaire. My business grew after I got on testosterone and got up on your program. And I've often said what I ought to do is treat males and say, I'm not going to charge you anything. I'll just take 10% of the increase in profits you make over the next 2 years as my payload. We haven't ever implemented that. But if I did, I'd probably be a multi-millionaire myself right now. So I want to encourage you to, if you're experiencing the symptoms of low testosterone, as I've described, I want you to consider giving us a call here at the Hotze Health and Wellness Center. We have what we like to call a ministry of health to our guests. We want you to obtain and maintain health and wellness naturally, so as you mature, you've got energy, you've got vitality, and you're enthusiastic about life. What's wrong with that? That's what everybody wants. We don't want to just get older. We want to have a good health span so we feel vital and active as we mature. So if that's what you want, please feel free to give us a call here at the Hotze Health and Wellness Center. It would be our honor to serve you.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.